Welcome everyone. It is 12 o'clock, so we will go ahead and get rolling here, and I will pass it off to Evelyn Nelson to get us started.
Super, thanks, Christy. I just want to give a big welcome to everybody joining us today for Better Behavior Together. It's part of our Telehealth Rocks program, which is a federally funded program that extends both telehealth behavioral health services to schools, as well as working together on strategies around social determinants of health. As part of that program, we extend trainings like we have today. Really excited to hear what the team has to share with us today. So just a few house cleaning items. Your microphones have been muted, but we'd love to hear from you throughout. So please do unmute or type in the chat. It's also a-okay to eat lunch with us. That's really fantastic. We appreciate you keeping your camera on if you're able to. That really helps us develop that community of learning, but we also are glad to have you here and understand that's not always possible. Please do type in your first and last names. It looks like most of everybody's already done that. That helps us get our certificates to you after the last session. Just along those lines, we're also recording today. So at the end of the session, you'll be receiving an email with both your certificate and with the video recording, as well as resources. I misspoke. It's not by end of day, not to give our internal team a heart palpitation. Just we'll be following up with that as soon as we can. So our presenters today, we're really pleased to have three wonderful behavioral health professionals to share their expertise and experience. Dr. Melissa Maris is a clinical community psychologist. It does a ton of work with schools, and I imagine has worked with several folks on the line as well. Dr. Lenny Swales is a child psychologist at KU Medical Center. It does a ton of training as well as direct therapy with young children. And then Dr. Alish Jha is a behavioral analyst and really bringing that behavioral perspective. Again, a ton of experience with both training and with clinical services. So with that, I'll pass the baton to the team, and thanks so much for joining us today.
So just a really quick project disclosure. We do not have any conflicts or financial relationships with the training that we're providing. And with the training, we really do want to provide information based on evidence that is currently available within the profession. And again, as Evelyn mentioned, the slides and recording will be sent to you as soon as they are done, and there will be certification at the end of the series. And if you have questions, please do email us at telehealthrocks@kumc.edu. So today it's going to be our third session of the 4-session series, and we are going to talk about ADHD and acting out behaviors. So there will be a short didactic session, and then we will be having a case presentation. We hope that we can have more time to discuss this case and with your input as well. So just want to bring us back to a couple of the slides that we talked about in the prior sessions about functional behavior and beyond immediate function, to just kind of refresh our memories. So again, when we are talking about disruptive behaviors and challenging behaviors, it is always really important to think about those basic functions related to seat. That always think about that chair, that seat, that related to sensory, escape, attention, and the tangible as well. And those are the basic functions that we can think about when we are conceptualize how we want to address those behaviors. And also the second slide here, we already saw it in the past, is about the ABC of behavior, and also adding the fourth one, which is the motivating operation. So the antecedent, the behavior, and the consequence are super important for us to consider what happens before the behavior and what happens after the behavior. but also really being mindful of the history of the child's environment, how they grew up, whether they have any maltreatment, and whether they have any history of trauma. Those are really, really important for us to consider as well when we are thinking about the more immediate function of their behaviors. And so thinking about the antecedent and the consequences, just talking about some of the antecedent strategies. The whole point of having antecedent strategies is to making the disruptive behavior irrelevant. So there's no motivation or there's no need for them to engage in those behaviors. So the very, very important antecedent strategy is to provide free or non-contingent reinforcers on a time-based schedule. So a lot of times when we are trying to provide reinforcers, it's always based on behavior. So if someone says something right, you say, good job answering that question. But when we are thinking about antecedent, to make sure that they have enough reinforcers they want so that they don't need to engage in any behaviors to access the reinforcer, we want to provide that on a time base. So for example, if a child a student really enjoying the teacher's attention or adult's attention, making sure that you are using strategies to build relationships throughout the day. And you might be just every 5 minutes go to that student and pat the student on their back or say, good job working independently, however attention that the child or student may enjoy. And those things sometimes could be like tangible things, right? Kind of like opera, you get an iPad, you get something. But for child, sometimes could be toys, could be access to breaks. But also, most importantly, could be those intangible things like attention and love and time spending together. And another antecedent strategy is teaching the replacement behavior and also really teaching that behavior to fluency. So making sure that you do not want to wait until the disruptive behavior happens to teach that. You want to be mindful and prepare that ahead. So if your child always tries to get your attention by acting out in the classroom, so making sure that the child knows how to appropriately get your attention would be really, really important to teach as a preventive measure. And making sure that you actually teach them to fluency, meaning that it will be super easy for them. They had plenty of practices. They had no problem demonstrating that behavior when needed. And there are many different ways to teach those behaviors. For example, role play. I always love recommending role plays to parents and teachers, and especially if they have siblings. I always think that role play is something. I'm sorry, my computer just turned off the camera itself. And video modeling is another really good one. So video modeling can be watching someone else's videos online. There are actually a lot of videos online that are showing how children with autism doing different things, like, for example, how they going through the dental clinic or other things. But also another really useful strategy for kiddos who really love looking at videos, looking at themselves, is to do self-video modeling. So videotape them doing that particular skill and then using that to teach them to do it more frequently and to teach them to fluency as well. Some other antecedent strategies include, like, for example, offer choices whenever possible. So when we offer choices, we can offer choices in terms of instructions. Do you want to do math work or other types of work right now? Or do you, we can also offer that in terms of rewards. So making sure, because if it's something that the child doesn't really want, then that cannot work as a reinforcer. So always making sure you ask, do you want to earn X or you want to earn Y? You want to earn the time to take a break? You want to earn the time to I am so sorry, this happened again. So you want to earn the time to go doing laundry with the teacher. This is something that I recently learned from a child. His favorite thing is to do laundry with the teacher. Okay, another strategy is really tailor the instructions to meet where the students are. So we talked about that. We kind of touched on that last week. Making sure that you are always mixing difficult tasks with easy tasks. And ideally, there should be more easy tasks and fewer difficult tasks, so that the task itself do not become overwhelming and above the child's level and making it really difficult for the children to complete. And of course, another really good anti-fitness strategy is visual support. And we cannot emphasize the importance of visual support, because it really helps us all, right? As an adult, we use visual support throughout the day all the time. Like, for example, calendar is a really good visual support. So making sure that we are providing that support to children so that their instructions are easier to understand, their days are easier, their schedules are easy to understand as well. And here are some consequence strategies as well. So the whole purpose of consequence strategies is actually making the problem behavior ineffective and inefficient, meaning that you are not going to be able to engage in those disruptive behaviors to get exactly what you want. And if it's ineffective and inefficient compared to the replacement behaviors, I think our kids are smart enough to learn, oh, okay, I should choose the replacement behaviors. So the most important thing is to reinforce the appropriate behavior whenever you see it, whenever you can. If that's the behavior you want to see, reinforce that. Catch them being good, catch them showing those behaviors. And of course, it's always really, really important while you are reinforcing the appropriate behavior, making sure you are stop reinforcing those behaviors that are somewhat challenging or disruptive. This is what we talked about last time about extinction. And then another strategy that a lot of teachers and parents use is response cost, meaning that if you engage in some behavior, there might be some kind of loss of privileges. It could be that instead of having a 20 minutes of TV time, you only get 10, you only get 5. And then overcorrection. Overcorrection is actually correct the mistake and practice the correct behavior. So making sure that when there is a behavior, like for example, if a child is throwing everything on the floor, making sure you actually practice throwing trash in the trash can and practice that with the child so they know exactly that's where they should be throwing things. And also let them know that, oh, okay, there is a consequence. So instead of throwing on the floor and having to practice that, maybe it will be easier to just throw them in the trash can. And of course, we have time out from reinforcers. One of those examples are planned ignoring, which we talked about last time. So just kind of re-emphasize some of the important points of planned ignoring is making sure you stay calm, minimize any attention, stay alert to catch good behavior. And again, ignore the behaviors, not the child. So I just have one last slide that's really trying to bring the antecedent behavior and a consequence message to home here. So this boy, you know, he wants to access those reinforcers, right? And the way the path to those reinforcers right now is through problem behavior. And when we look at antecedent and consequence strategies, what we can do is that we provide a lot of reinforcers to the child so that they have that and they do not have the motivation to engage in problem behavior to get that reinforcers. And at the same time, we block those or stop reinforcing those problem behaviors. And we also need to teach them appropriate behavior that can lead them to the reinforcers. So that is often, those components are often included in the behavioral intervention plan. The most important message here is to make sure that the child has an appropriate way to get the same reinforcer the child was motivated to get through problem behavior. Okay, Lenny, I'm going to turn it over to you.
I'm going to talk some more about ADHD. So when we think about ADHD, those kiddos have a high rate of all behaviors, right? They're like Tigger, where they're bouncing around, they're doing a lot of things all at once. And the challenge is they're probably doing a lot of things that are really appropriate, and they're also doing a lot of things that are really inappropriate too. It's just a high rate of all behaviors. The problem is because they're doing that stuff so much, what is it that our ADHD children are hearing from adults? They're hearing, quit it, no, running, stop that, don't, no, that's not how we, and so we're kind of constantly trying to, because they're showing this high rate of disruptive behaviors, we're constantly giving this negative feedback, right? And let's think about what the impact of that is. One, what's that kid hearing all the time? That they're doing stuff wrong. And so that can impact self-esteem and self-image. And then also, we just talked about how attention can, positive or negative, can be a motivating factor for lots of kids. So every time we say, quit it, no, stop, don't, whatever, every single time you're providing attention for that negative behavior, right? So it's doing two things at once. It's decreasing self-esteem and it's providing attention for negative behavior, which makes it more likely it's going to happen in the future. So what we have to do for kids with ADHD is we have to find a way that we flip that. And so knowing that they've got this high rate of all behaviors, both disruptive and positive or neutral ones, we need to flip it. So that now what they're hearing is, thanks for sitting quietly. I like the way you're sitting still. You're doing a really good job staying on your work. And that way we're flipping it. So they're hearing a more constant stream of reinforcement for what they are doing right. The other thing is that because kids with ADHD have a short attention span, they're less likely to pay attention when you do give them feedback. So we need to make sure that we are really consistent in our response to their behavior. Kids with ADHD, all kids, they benefit from our consistency, right? That's not the reality, that we can't always be 100% consistent, but kids with ADHD need that even more. They need more consistent positive feedback, and then they also need to have really good consistency for how adults do respond for negative behavior too. So our overarching goal is to provide positive feedback every time the target behavior occurs. That's the goal. I know that's not reality, but that's what we're shooting for. The benefit is that we're going to flip it, and so they'll get more attention for positive behaviors instead of negative. And then also, because of that short attention span with ADHD, every time they hear that praise, it's going to remind them, oh yeah, that's what I'm supposed to be doing. So if you got a kid who's sitting at the desk and then you walk by and you say, thank you for working quietly, for all you know, they were about to get distracted and start talking to their neighbor. And when you provided that praise, they're like, oh yeah, that's what I'm supposed to be doing, and helps them stay on track. Next slide. I do want to talk a little bit about some diagnostic disparities that exist. So we know that African American and Latino children are less likely to be diagnosed with ADHD. And often instead, they're diagnosed with a disruptive behavior or conduct disorder. We don't think that there's any true differences in the population. We think that most likely this is because we are not identifying those kids who have ADHD as having ADHD. Instead, we're labeling the same behaviors as because of disruptive behaviors or a conduct disorder. That can have some really big implications. Because we know that one piece of ADHD treatment is medication. And so if we're conceptualizing this as because of a child's disruptive behavior, we're less likely to offer them all of the array of interventions that might be effective, right? So just some more stats about this. African American children are 2.5 more times more likely to be diagnosed with a conduct disorder than ADHD. And this is also has some relationship with socioeconomic status, where high SES families more likely to have a diagnosis of ADHD. And then families who are low income and use Medicaid are 5 times more likely to have a diagnosis of a behavior disorder. compared to privately insured families. So there's some evidence that there's some bias in how we're identifying these groups, and we want to make sure that we really are equally identifying when individuals truly have ADHD. Yeah, next slide. So when we think about the best practice treatment approaches for ADHD, the recommendation from the CDC and the American Academy of Pediatrics and a whole bunch of other groups too, is that we use a three-prong approach. The first prong is school-based supports and interventions. The second is behavioral family therapy. That would occur outside school where the parents and child together are working with a behavioral social worker, therapist, or psychologist. And then the last piece is medication. So for children under the age of 6, the recommendation is that you start school supports and behavior therapy before considering medication. For kids over the age of 6, the recommendation is to do everything all together. What we know from the current CDC data is that in Kansas, kids are more, I don't have the data on school-based supports, unfortunately, but I can tell you the data on medication and behavior therapy. In Kansas, about 63% of children who have ADHD take medication for it, whereas only 42% receive behavioral therapy. That's something that's concerning to me. I have a lot of questions about why that is. I think part of it is we have difficulties with access to behavioral therapy in Kansas. But then I also think making sure that everyone who works with kids know that it's really this kind of three-prong approach is what the treatment should be for ADHD. Too often, I think the understanding in popular media and stuff like that is it's really this medication approach, but it really should be all three together. The CDC has some fabulous, really family-friendly handouts that talk about this three-prong approach and also talks about what exactly good therapy should look like. And we will send those out along with the resources after the program today. There's a question from Christina. Christina, if you're able to unmute and ask your question or clarify a little bit for me, I would love to answer it.
I was eating, sorry.
That's okay. I'm sorry for
No, it's fine. Is this number the medication before the behavioral therapy? Do you think that has to do with the number of kids in foster care?
That's a great question and a whole other big can of worms that Kansas needs to tackle, which is we have too many kids in foster care in Kansas. I don't know. I don't know the answer to that. That's an interesting question. I think it doesn't kind of break down the data farther than that. I can tell you that where Kansas lines up compared to other states is that we're not alone in this trend, but we're definitely not doing the best. If you look at kind of the whole US, there's other states that have a much better kind of ratio of access to behavior therapy or doing both things together. Next slide. So the question is, so we know that it's kind of this three-part approach, but you at school only have control over one part of that, right? So what you can control is the school-based accommodations and supports. One of my favorite resources is using a daily report card or a homeschool note. And actually a lot of research has been done on this, and it shouldn't be surprising at all that it's really effective. It's a great way that what you're doing at school, that we can then get families to use at home. And that way we're trying to get a little bit more of that home use of the same behavioral principles, which is the idea of that behavioral therapy. So the homeschool note should identify a few concrete behaviors. So the example I have here in green is completes assignments with 80% accuracy, follows teacher directions with 2 or fewer reminders, and is respectful to peers with 2 or fewer reminders. There's even a simpler one above that that just says follows directions, stays on task, and completes assignments. And then the idea is that you would send home that quick daily report card each day. And then try to engage the family. Ask the parents, what do they think would be easy and meaningful rewards? And we could either think about having those rewards be things they earned at school, or it could be things they earned at home. I think it really depends on the individual child, which one, home versus school rewards, is going to be the best or most effective. I prefer to stay away from prize boxes or food-based rewards. And instead, I really like activity-based rewards or giving kids more choice and autonomy. Those are often really motivating for kids, and they don't get bored of them quite as easily as they do of like a new toy or a sweet. Although most kids don't get sick of sweets, it's more of I want to make sure we're reinforcing healthy eating overall. Side note. Okay, so things like electronics, renting a movie, trips to the park, bringing a special note to the front office, helping take care of a class pet, or giving a break in the sensory room are often great rewards. And then the other thing we can also do is if you're finding that you're using a reward system at school that's working super well, tell the family what it is. I'm often doing that behavioral family therapy, and I ask families, what are they doing at school that works well? And they say, I have no idea. If you're able to let them know via a short note or say, hey, we're trying this at school, why don't you try it at home? Let me know if it works. That's a great way that will have more consistency, which we already talked about is super important, and you're helping to have a little bit of impact across settings. Next slide.
So we wanted to wrap up our didactic portion today by talking a little bit about shifting from targeted to universal strategies. So we've tried over this series to talk about functions of behavior and those kinds of responses. Oftentimes we are conceptualizing that based on an individual, but then here trying to generalize around what can this actually look like in practice, and how to make this as realistic as possible. And so kind of two pieces here. One is that a lot of the feedback that I have gotten around challenges with implementing any kind of individualized support plan for a student, whether we're talking about a 504 or an IEP or even just a behavior management plan, a new strategy, is the adults in the school community struggling with pushback from other kids when the student who is learning a new skill is getting rewards for something they're already doing, or that it's a different kind of reward. And so kind of this question and this pushback of, well, that's not fair. That's not fair that Billy gets to take this to the front office. I do this every single day and I never get to go to the front office. And so I think one of the strategies is to anticipate that that is going to happen and figure out how you're going to respond. So I'm a big fan of trying to plan ahead and being proactive, and then just having kind of really basic rote responses. So the first one is understanding where that's not fair comes from. So the reality is that for a lot of young people, where they are in their thinking is that it really just isn't fair, right? And so they are putting these things together in pretty simple terms. Perhaps they are still developing their ability to take perspective, right? And so they aren't thinking about this necessarily the way that anybody else would, certainly not an older or even an adult, but they're tending to look at this in a very narrow way. And so just acknowledging that feeling of that's not fair is normative. And a lot of times it makes a lot of sense. I think oftentimes we're also equating that same and fair are the same thing. And so there's a lot to unpack around that. But just acknowledging and trying to understand where it comes from. I personally find that when I can understand a behavior, that it unlocks this whole other box of empathy tools and these other strategies. And so I try to really understand where the behavior is coming from. I think the second thing is reflecting on your automatic response and maybe just thinking about whether or not it's working for you, if it's not working for you, and if it's consistent with your values. So, I mean, certainly even with my own children, I still have this automatic feeling when they say it's not fair that I just want to say, well, life's not fair, because that's what I heard growing up a lot. Well, get used to it, Melissa, life's not fair. And so kind of checking, saying, okay, if that is my automatic response, I'm not judging it, I'm just recognizing it. And then really kind of figuring out, is that how I feel? Is that consistent with my values? And when I say that, is it working? Is that working to decrease the behavior and to help everybody feel like they are part of an inclusive learning community? So just kind of reflecting on your automatic response. And then maybe kind of reconsidering or reframing or adjusting kind of how you respond. So this is kind of a quick sort of kind of prescription for kind of some potential for those responses. So one is just acknowledging the feeling. So when someone is saying that's not fair, there's a feeling there somewhere. So validate the feeling, take a stab at it. And you don't have to make this a long, protracted kind of statement. So there's no need. I mean, if you want to try to make it specific. So when Johnny gets X, you feel Y, or you could just kind of throw a feeling out. This is hard. This feels unfair. This feels sad. This is sad, right? So just kind of take a stab at validate the feeling. Try as much as you can to keep it really, really simple. This isn't a place to over-explain ourselves. Focus on this idea of different needs at different times. So really individualizing that response and kind of having that sort of phrase. So we all have different needs at different times, or everybody needs something different to succeed at some point, like something very standard that applies across the board. And then trying to wrap it up with something that connects it to a general statement that would apply to the entire class. So something's happening, I reinforce, someone else says, this isn't fair. Then I could say, this feels really hard. We all need different things at different times to be successful. I am so glad we all work together in this classroom to help everybody succeed, right? So going individual and then a general kind of statement of culture. And so kind of thinking about that sort of strategy. And then the second thing I just wanted to touch on briefly is this idea of kind of working smarter, not harder. So I think one of the more challenging and sometimes seemingly impossible things to do is working with a lot of different young people who have different behavior management plans in play. Where there are different reinforcers that have to happen at different times. So a lot of times when we get really into behavior planning, we are working with a young person who is consuming a lot of the energy, either of the teacher, the adults, maybe the front office, of their family. So they're consuming a lot of energy around these behaviors. And so we spend sometimes a lot of time trying to understand where the behavior is coming from and then putting a strategy in place. And that's great. In the end, it's worth the investment to figure out reinforcements that will work to then, in the long run, save time and energy. But what I would invite you to do is when you're in a situation, ask for or provide to someone else as much flexibility as possible. So it is not unusual, and anyone in a school has had this experience where a young person will come in or a family will come in from the doctor and actually have a prescription for an IEP, a 504, a specific strategy in the classroom, which feels awful. And sometimes the suggestions are great, and sometimes they're completely unrealistic, right? And so we really want to focus on things that can actually feasibly happen in the setting that they're supposed to be implemented, right? So the best possible strategy is not going to work if it's not implemented well. And when things are not feasible, they're not going to be implemented well. And so if you're brainstorming, perhaps as part of a problem-solving team or a SIT team, and someone says, oh, well, this could really work, or the family says, oh, well, at home, this kind of response is really helpful, kind of giving yourself permission to maybe problem solve and push back a little bit and say, okay, I'm excited to hear that works. Can we talk about how we could do that reasonably in the library or in the PE class? How can we kind of think that through? Being strategic with your time and energy, and again, just being realistic. None of us are superhuman. And so if we are juggling all of these different pieces all at the same time, at some point it's not going to work. And so we need to be able to have a reasonable plan and giving yourself grace. So it is not at all uncommon for adults to work really, really hard together to figure out how to decrease a behavior. And then somebody has a tough day and they just go back to other behaviors, the adults, and then all of a sudden we see the behavior increase again, right? And so it's okay. It's okay to miss the opportunity to reinforce. It's okay to go back to something else. Just try to get back on track, right? And so in recognizing that this can be really, really hard to try to implement, and so giving yourself that kind of grace. And the last one, and we've emphasized this over and over again throughout this series, is trying to find those universals and really kind of thinking about the universals kind of on a continuum. So ideally, you're using things in the classroom that can be successful and help all young people feel successful, right? And be successful. And that's your go-to first. And you do that for a little bit, right? And that's going to work with most kids. That's why it's called a universal. It's not going to work for everybody, but it's going to work for a lot of young people. Consistency and predictability is one of those things. And then you find this other group, right, that needs more. So then you do a little bit more. This is not when you go whole hog and throw in, the high cost, high time interventions. Do a little bit more and see how much that reinforcement can pull in, and then kind of work your way up from there. What you don't want to find yourself doing is trying to implement a really complex behavior plan in a classroom when you're also trying to juggle a whole bunch of other things. So kind of having that feasible sort of approach.